Zebra Life Sciences has developed a unique technology based on the thermoacoustic effect that combines two forms of energy, radio frequency and ultrasound, in order to characterize tissue composition. ENDRA's non-invasive imaging approach uses short radio frequency pulses to provide energy that is differentially absorbed and generates ultrasonic waves that can be detected by an integrated ultrasound transducer. This technology, thermoacoustic enhanced ultrasound, or TAEUS for short, provides physicians with a simple, fast, non-invasive, and cost-effective method to determine the presence of fat in the liver. The TAEUS fatty liver imaging probe, that we call FLIP, will provide a quantitative measure called the thermoacoustic derived absorption parameter, or TAP. In physics, TAP is known as the complex relative permittivity, the friction in the system as energy is stored in an electric field. In liver tissue, the complex relative permittivity is highly correlated to the magnetic resonance proton density fat fraction, the current quantitative gold standard in non-invasive, non-alcoholic fatty liver disease assessment.
The cart-mounted console, seen here at the head of the examination table, contains all system electronics. Dedicated software is used for controlling scan operations and for processing and displaying data. All software controls are conveniently displayed on a dedicated, compact touchscreen monitor. The heart of the TAEUS system is its handheld fatty liver imaging probe, or FLIP probe. The patient contact surface consists of an applicator that directs short pulses of radio frequency waves into the liver and an integrated ultrasound receiver for measuring the thermoacoustic response. First, configure the ultrasound system for B-mode scanning. The ultrasound system is used to define a gross region of interest for the TAEUS scan and to determine the depth of the measurements to be acquired. Position the patient in a supine position for a right lateral abdominal exam with the right arm over the head. To locate the region for liver fatty tissue assessment, palpate the inferior edge of the xiphoid process, move laterally to the right upper quadrant, and locate the intercostal space. Apply ultrasound gel to the probe or along the selected intercostal space. A good liver window should be void of vessels and gallbladder, with the surface of the liver as parallel as possible with the probe. Freeze the image and mark the position of the probe. Next, measure the distance from the skin surface to the border between the subcutaneous fat and intercostal muscle. TAEUS will utilize the thermoacoustic signal from lean muscle at this location as an internal calibration, as it is not affected by hepatic fat content. Now measure the distance from the skin surface to the surface of the liver capsule. The thermoacoustic signal measured at this location reflects the degree of hepatic fat accumulation. We will now use the dedicated TAEUS software to start a scan. Tap the New Procedure button on the touchscreen monitor. Then press Confirm to proceed. On the next screen, drag each of the two slider bars so that the distances displayed correspond to the muscle and liver distances obtained from the B-mode image. Press the arrow keys for fine positioning adjustments. Then press the arrow icon to proceed. When the Ready to Scan screen appears, remove the FLIP probe from its holder and place the ultrasound receiver in the same position that the ultrasound probe was in for the B-mode scan. TAEUS uses the same foot switches as the ultrasound system for hands-free operation while scanning. To make a measurement, press the right foot switch. If your ultrasound system is not equipped with foot switches, you can press the simulated Measure foot switch on the touchscreen display to initiate a measurement instead. When the scan has completed, a graphic is displayed that represents the measured thermoacoustic signal. Ensure that the boundary definitions align with the signals from the muscle and liver, and readjust the boundaries if necessary. If the two signals are not clearly defined, press Reject to perform a new scan. Press Accept to generate numerical data. Perform up to 10 scans per patient. Data are displayed in the right panel, as are any previous scans obtained from the same patient. The average value is displayed in the bottom right corner. Record this value offline before proceeding to the next patient. The ENDRA Life Sciences team will be happy to answer any additional questions you might have. Thank you.